Hello everyone, today we are learning Module 2, Caregiving for Individuals with Mental Health Disorder. We did Module 1 the last time from Mental Health book. Today we're doing the Module 2. Lesson 2 is Compassionate and Trauma-Informed Care. Culture and Ethnicity. Uh, as you can see here in the picture, we have different cultures, even if you talk about jokes, eh, the culture in one country joke doesn't make you laugh to the other culture, and the food that every culture eats are different. The clothes that we wear, each culture is different, and each culture has their own things. So when we are working with mental health care, people problem with mental health care, people we need to understand that they come from different backgrounds. All people have the right to be understood and have their culture valued and respected and be treated with dignity. Understanding the culture of individuals with mental health disorder helps a caregiver to give culturally appropriate care. So it's very important to know the culture. Caregivers need to avoid stereotypes. Stereotypes are untrue beliefs that many people have about all people or things with a particular characteristics. It's oversimplified opinion or prejudiced attitude. Let's say some Japanese guy, he was born here, but when we look at him, we think that he doesn't know English. That's like stereotype. And there's a lot of things that we can talk about stereotypes. It just generally, stereotype is just oversimplifying. It's just like you don't tell a book by looking at it. You have to read it. It's just like that. So we can't judge people by looking at them. So we need to know them. To provide culture appropriate care, you need to know the person as a whole. Trauma-informed care. Trauma-informed care is teaching us, people of mental health problem they have different kind of trauma. So we need they have a trauma that they passed in their life. So we need to understand they have trauma. As you can see here, this person when he's young, maybe he was treated badly with parents, and this one they have a lot of things on his head that this person passed. So understanding of trauma and awareness of the impact it can have across settings, services, and population is very important. Trauma is experience that cause intense physical and psychological stress to a situation. And trauma produces a sense of fear, vulnerability, and helplessness. A lot of people, most of mental health problems with mental health people, they have trauma when they were kids or at some point in their lives they have trauma. So we need to understand that they have a hard time and they passed a very hard life. We don't know what it is, but we just need to understand them. Generally, mental health conditions increase the risk of experiencing trauma, and trauma increases the risk of developing mental health disorder. They go hand in hand. Resilience. Resilience is a mindset that views clients presenting difficult behaviors and emotions as a response to surviving trauma. Resilience helps the caregivers to view traumatic stress reactions as a normal reactions to abnormal situation. So as you can see here, this guy is kind of trying to push it up. He's trying to get it back in place. So resilience is when the caregiver views the clients, they have a trauma in their past, and even if whatever they do, even if it's weird or something, it's not right, they consider them as normal because that's their normal behavior. That's resilience. So we're trying to make people to bring them to their normal behavior. So we need to promote resilience by encouraging individual strengths, help individuals identify what has worked and what's not worked, you know, and develop interventions and coping strategies that are more likely to fit to their strengths and resources. Recovery usually involves increasing a person's ability to make changes they want in their life, focusing on the person's strengths and the choices they want for their lives, not just for their symptoms. Lesson 3 is about supporting for wellness. The goal to provide the best possible holistic care. When we are giving care, the goal is to do the best holistic care. Caring the whole person, taking into account mental and social factors rather than just physical symptoms of the disease. Providing care for individuals with various mental disorders can be challenging as well as rewarding. So the first thing we need to figure out was what's the baseline of the person. Baseline is a time when a person with mental disorder is managing his or her symptoms and functions at his or her own higher level. What's the baseline for this person? So we know the baseline, and then when something is out of the baseline, that's when we pull them up to put them in their baseline. When they fall, we pull them up. The goal is to help individuals to get their baseline and stay there. So, to do that, we need to encourage the person to continue treatment and to take their medication appropriately. Encourage the person to take small steps towards the goal, and we need to support and help to cope obstacles as they arise, and help to identify what causes the stress and help to find a way to reduce it. Each person baseline is different, so we work with each individual separately. There are 8 dimensions of wellness. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. Wellness strategies are practical ways to start developing healthy habits that can have a positive impact on physical and mental health. There are 8 dimensions of wellness. They are all in here: emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. Occupational is work, social is your social life, physical, how healthy you are, intellectual, your brain, how smart you are, emotional, how is your emotions, and environmental, the around where you live, and financial, the money that you get, and things like that, and spiritual. Person-centered planning. As you can see here, the person is centered in here. He's the main one. Even if there are a lot of things around him, he is the center. So person-centered planning is planning the person at the center and above all other aspects of treatment process. It's important that people are seen first as people and not as their illness. So we're not supposed to call people you are lunatic or you are bipolar or schizophrenic like that. So we need to identify people, the titles they feel most comfortable with. When in doubt, we have to find someone, we have to call someone by name and ask how you should address him or her in the future. Use the holistic approach with an attitude of respect for the individual. There are conventional medicine and unconventional medicine to give medication to people. Conventional medicine can be used in treating several mental disorders and conditions. This medication cannot cure mental disorders, but they help them. A lot of medicine, the doctors prescribe them usually. There are many side effects associated with taking conventional medicine. Your main job as a caregiver is to be aware of any side effects for each individual and take appropriate action. Antidepressant. Now we're gonna look at some medications. This is just for you to know, just some ideas. Antidepressant medications, they improve symptoms of depression and keep depression symptoms from coming back. They usually work for depression, anxiety, pain, or insomnia. There's a lot of medications that are in that category, like fluoxetine, citalopram, sertraline, paroxetine, serotonin, norepinephrine, reuptake inhibitors like venlafaxine, mirtazapine, duloxetine, bupropion. When you work, you will see all this medication, and we need to see the side effects. That's the main important thing. Usually, most side effects are in here: nausea, vomiting, weight gain, diarrhea, sleepiness, sexual problems, thought about suicide, new or worsening depression, feeling of restlessness, panic attack, trouble sleeping, unusual changes in behavior or mood. Antipsychotic medications. Antipsychotic medication, they primarily manage psychosis, but also used to stabilize mood and bipolar disorder. The psychosis is disruption to a person's thought and perception that make it difficult for them to recognize what's real and what's not. We use them for psychosis and bipolar. Sometimes we see a relapse. Relapse is symptoms come back or worsen when the medication are stopped. When some people stop their medication, a relapse happen. There's a lot of medication they work for antipsychosis, like chlorpromazepine, haloperidol, propofol, risperidone, olanzapine, quetiapine, ziprasidone. There's a lot of them. The side effects are like drowsiness, dizziness, restlessness, weight gain, dry mouth, constipation, nausea, vomiting, blurred vision, seizure, low blood pressure, muscle rigidity, muscle spasm, tremors. There are extrapyramidal symptoms. These are symptoms like muscle rigidity, muscle spasm, tremors, and restlessness. These are called antipyramidal medications. Um, the medications that are included in here are usually benzotropine, amantadine, or artrine. Their side effects are like dry mouth, blurry vision, and constipation. So anti-APS medications. These are the long-term use of a typical antipsychotic medication. When the people take the long-term, these side effects can happen. Long-term use of atypical medication may lead to conditions called tardive dyskinesia. This causes muscle movements commonly around the mouth, range from mild to severe. This is just for information to know. You don't have to know each medication and what they used for. This is just an idea, just to give you a glimpse of it. Mood stabilizers. These are stabilized by decreasing abnormal activity in the brain, usually used for depression and bipolar. Medications like lithium, carbamazepine, valproic acid, lamotrigine, oxycarbamazepine work for that. The side effects for this are like itching, rash, excessive thirst, frequent urination, hand tremors, weight gain, hair loss, nausea, vomiting, slurred speech, fast, slow, or irregular pounding heartbeat, blackouts, changes in vision, seizure, hallucinations, loss of coordination, welling of the eye, face, lips, tongue, throat, hand, feet, ankle, or lower legs. Anti-anxiety medications are like help reduce the symptoms of anxiety. For example, benzodiazepines like clonazepine, alprazolam, or lorazepam. In SSRIs like sertraline and citalopram. The side effects for this are like nausea, blurred vision, headache, confusion, tiredness, nightmare, falls, drowsiness, dizziness, anesthesia problems with coordination, difficulty thinking or remembering, increased saliva, muscle or joint pain, frequent urination, blurred vision, change in sex drive or ability. There might be more. These are like the most of them. The stimulants are increased alertness and attention and energy. They usually increase blood pressure, heart rate, and respirations. We usually use most this for ADHD because they have their attention span is very short. Like Ritalin, amphetamine, dexedrine, we use those medications most of the time. The side effects are like difficulty falling asleep or staying asleep, loss of appetite, stomach pain, headache, motor tics, verbal tics. These are like repetitive movement or sounds, personal changes, and in appearing flat. Chemical restraints. Now let's talk about chemical restraints. Chemical restraints are the administration of any drug to manage a vulnerable adult or others to get a temporary effect or restricting the vulnerable adult freedom of movement. The use of chemical restraints constitutes abuse in Washington state. Individuals have the right to refuse medication. Whenever a client refuses medication, our job as a caregiver is to report the medication refusal to the provider who prescribes it. There are non-drug therapies. It's not always medication. There are a lot of non-drug therapies. The first one is psychotherapy, which is a talk therapy. As you can see here, these people are talking. That's talk therapy. Talk therapy usually identifies a person's identity, change in troubled emotions, thoughts, and behavior. It can be done one to one or in a group setting. The talk therapy or psychotherapy usually helps ways to cope with the stress, examine personal interaction with others, relaxation and mindful techniques, and track emotions and activities. Brain stimulant therapy is another non-drug therapy. It involves activating or inhibiting the brain directly with electricity. This is brain stimulation. There's a lot of alternative therapies. The alternative therapies limited or no scientific studies for effectiveness of treatments. One is like acupressure. Acupressure is applying pressure to certain points around the body in order to stimulate the body's own healing process and bring health benefits. This may boost immune system, relieve stress, relieve headache, alleviate other aches and pains, and increase circulation. These are one of the alternate therapies, and acupuncture is another one. This over here is acupuncture. It's stimulating certain healing points are called acupoints to stimulate the body's own healing mechanism. The insertion of this method uses the insertion of very small tiny needle into the top layer of the skin and muscles. Aromatherapy is use of scent and aroma of natural oil to alleviate a range of emotional and physical concerns from stress and anxiety or to blocked sinuses, pain, and cognitive functions. Scents from natural oils smelled or applied to the skin. This is what the aromatherapy represents. Exercise is another one. Exercise reduces stress and it boosts endorphins, improve self-confidence, prevent cognitive decline, alleviate anxiety, boost brain power, sharp memory, help control addiction, and improve relaxation. And music therapy, this is another non-drug therapy, alternative therapy. The use of music to help treat and alleviate range of emotional, cognitive, and physical concerns. Naturopathic medicine is avoiding chemicals or medication intervals when they are not wanted or needing. They're just avoiding them. Include nutritional, dietary, natural, holistic, herbal, ancient, just like a mix of them is naturopathic medicine. And nutritional healing is consuming a certain diet of natural foods and supplements and helps to treat certain ailments and disorders. This is the nutritional healing. Nutritional supplement is another one. This one is any type of supplement that's ingested for nutritional benefit is nutritional supplement. A massage is another one. This is a massage. As you can see, the guy is laying down and he's getting a massage. A massage is a rubbing and kneading of muscles and joints in the body with the hands to relieve tension or pain. This will cause improved mood, reduce stress, anxiety, and even increase the feeling of caring, comfort, and connection. Reiki is this one. Reiki is a traditional Japanese therapy centered on the use and transfer of energy from the healed body to that of the subject in order to stimulate the body's own natural healing process. They believe it's relieve stress, generate overall feeling of relaxation and well-being. As you can see here, the person is transferring energy, and like that. The spiritual mind treatment is another one. It's affirmative prayer, individual focus on thought and prayers to make changes and heal the body and mind. The prayer goes to one spiritual being, guides the universe. It calms the mind and elevates stress. And the other one is support groups, a group of people who come together to discuss and share stories of their common experiences that reduces stress, anxiety, and provides support network. Visualization is another alternative therapy. It's a guide image therapy. Individual image a certain outcomes to a situation, an object, or an action, guided by an audio track or the voice or a trained therapist, or without any guide. It treats addiction, easing stress and anxiety, stop bad habits. Yoga is another alternative therapy. Spiritual and physical practice involve various postures, stretches, and visualization, and breathing exercise performed in a sequence. Increases flexibility, strengthens muscles, calm and centered mind, elevated stress and anxiety, and improve sleep. Now we're done with alternative therapy, but the book wants us to know just for you to know what's a cannabis. Cannabis is marijuana; they are the same. And these are the cannabis are illicit substances in the United States. Marijuana is a psychoactive substance. It affects how the brain works. It blocks the message going to the brain. It causes changes in mood, awareness, thought, and feeling and behavior. It alters the perception and emotion like vision, hearing, and coordination. Cannabis may help reduce symptoms of certain medical conditions. It also increases the risk of heart, lung, and mental problems. The use of cannabis is still illegal under the federal regulation, and Medicaid cannot be used. So marijuana is illegal, just for you to know. Lesson 4 is getting help and self-care. Caregiver mental wellness. Now we talk about all how we care for clients. Now we need to have a wellness education for us, for the caregivers. Caregivers need to take a break for meals or just step away from work area just to refresh their brains, to just decrease the burnout. Avoid working overtime on a routine basis if you don't have to. Devote time off the job to activities to nurture you. Need to spend time with family, friends, reading, watching movie, exercising. Allow time to rest. Take steps to manage stress. Or you can do more things that are not listed here as long as it works for you. Now let's see about secondary trauma. Secondary trauma or compassionate fatigue trauma is trauma-related stress reactions and symptoms resulting from exposure to another individual traumatic experiences. The trauma is not on a caregiver, but when the caregiver see another client trauma, they will get traumatized. That's what it is. That's why it's called secondary trauma. The trauma is not them, but the clients. But when they are taking care of them, that the trauma they're seeing, is a secondary trauma for them. Symptoms are like chronic fatigue, sadness, anger, poor concentration, detachment, emotional exhaustion, fearfulness, shame, physical illness, abstinence. All this we see on a caregiver. So the caregivers need to prevent it by practicing personal wellness techniques and establish a diverse social support network as much as possible. So the strategies to cope with caregivers burnout, some of them are listed here. Caregivers may feel overwhelmed, exhausted, and frustrated. No matter how overwhelmed you feel, it's important that you make and take time for yourself. Some tips that I listed here are: put your physical need first. Just say no. You don't have to do everything, and if you something you cannot do, or if you are overwhelmed with too much to do, you can say no. You connect with friends, talk with a friend, stay positive, ask for help if you need one, be proactive, take time. Set your goal. If you have to go somewhere, plan your stuff, deal with your feelings, find time to relax for yourself, talk about your feeling. If you do that, you wouldn't have a burnout. You get a break. Thank you very much. We are done for with model 2 today. Thank you.